Hey, and welcome to The Explainer. Look, if you're a parent or a caregiver, you know the deal with diaper rash. It can be so stressful for everyone, but honestly, understanding what you're up against is half the battle. So in this Explainer, we are going to break it all down.
So, let's just kick things off with a question, one that really puts this whole thing into perspective. What do you think is the single most common skin problem for babies?
Yep, you probably guessed it. It's diaper rash. The official name for it is diaper dermatitis, and it is so incredibly common it's considered the #1 skin issue of infancy. So if you're dealing with it, trust me, you are not alone. All right, so if we're going to tackle this thing, we've got to know our enemy, right? Let's define exactly what we're up against.
So what it really boils down to is this. Diaper dermatitis, or DD, is a type of contact dermatitis. And all that means is that it's a skin irritation that happens when the skin is in contact with irritants for too long, and in this case, those irritants are urine and feces. Pretty straightforward.
And when does this pop up? Well, pretty much any time during infancy. It can show up as early as the first week of life, but the time you're most likely to see it is between 9 and 12 months old. It's just a super normal part of this phase.
Okay, so we've got the what, but what about the why? What is actually going on with the skin that causes that angry-looking rash? Let's dig into the main culprits here.
You know, it's not just one thing. It's kind of like a perfect storm of factors. First, you've got trapped moisture, which makes the skin way too soft. Then there's friction, from the diaper rubbing and all the wiping. And the real kicker? Urine and feces actually raise the skin's pH level, which damages its natural protective barrier. All of that together is a recipe for irritation.
Okay, this is super important. Not all diaper rashes are created equal. The most common kind is just simple irritant dermatitis. That's when you see that shiny redness on the baby's bottom, but the little folds of their skin are usually fine. But if the rash looks beefy red and has these little spots spreading out, and it's getting right into those skin folds, that's a huge clue you're probably dealing with a candidal or fungal infection. And knowing the difference is everything. So we've identified the problem, and now for the good part, the solution. And the best news is your first line of defense is a really simple, non-medical game plan that anyone can follow. We're talking about the ABCDEs of diaper care. And I'm not kidding, this little mnemonic is a lifesaver. It's a super helpful, easy-to-remember guide for both preventing and treating diaper rash. So let's walk through it. First up, A, B, and C. A is for air. Seriously, letting your baby have some diaper-free time to just air dry is one of the best things you can do. B is for barriers. This means putting on a protective cream at every single diaper change. And C is for cleansing. The key here is to be gentle. Use water and a soft cloth or gentle wipes. And please, no vigorous rubbing. And then we have D and E. D is for diapers, as in change them often. For newborns, that's about every 2 hours. For older babies, every 3 to 4 hours. Using super absorbent diapers can also be a game changer. Finally, E is for education. Just knowing these steps is the most powerful tool you have for prevention. Okay, but what happens when the ABCDEs just aren't cutting it? Sometimes you need to call for a little backup. So let's talk about the specific products you can bring in to help. When you're standing in that aisle looking at all the creams, it can be really confusing, but it really just boils down to 2 main types. For day-to-day prevention, a simple barrier-only product like petrolatum is perfect. But if you're treating a rash that's already there, you want something that's barrier absorptive. Look for a cream with 20 to 40% zinc oxide. It doesn't just block moisture, it helps absorb it. So remember that fungal rash we talked about? How do you know if that's what you're dealing with? Well, there are some pretty clear signs. If the rash has been there for 3 days or more, if it has that beefy red look with those little satellite spots, or if it's deep in the skin folds, it's probably fungal. And here's a pro tip. Always put the antifungal cream on first. Let it sink in, then put your regular barrier cream on top. Now, most of the time, you can absolutely handle this at home, but it is so important to know when it's time to stop and just pick up the phone to call the doctor. So let's go over those red flags. You need to get a professional opinion for sure if you see any of these things. A rash with blisters or any kind of oozing,
or if it just seems really painful for your baby. Also, call if your baby has a fever, if the rash starts spreading outside the diaper area, or if you've been doing everything right for a week and it's just not getting any better.
And that really brings us full circle, back to the most powerful idea in all of this. As our source material puts it so perfectly, the absolute key here is prevention. By sticking to those A, B, C, D, E's and just being proactive, you can often stop diaper dermatitis before it even gets a chance to start. And that is the ultimate win. Thanks for joining us on The Explainer.